Where are you supposed to have these conversations? The onus from the government's end is you're supposed to be the front line to get people off vapes. If not, you're meant to hand them over. Now, you don't sell cigarettes. This puts you at odds with all other health professions if you're flogging vapes.
We're here. Community pharmacies is the most frequently visited and accessible primary healthcare destination in Australia to deliver healthcare, not to peddle nicotine-containing vapes that have little evidence of being a therapeutic benefit. They're not registered on the Australian Register of Therapeutic Goods from our medicines regulator, the Therapeutic Goods Administration, the TGA. Thanks to a secret deal between the Labor government and the Greens, we're riding roughshod over our public health experts that we've trusted for decades to give advice on the appropriate availability and accessibility to medicines and devices. And because of a deal to get something through the Senate, we're just riding roughshod over our public health experts and forcing this on a profession that hasn't been consulted or asked. To your question, where would these conversations happen? Pharmacies are well equipped to have conversations with patients in private areas, and we're doing so much more in primary health care in terms of prescribing antibiotics for urinary tract infections and repeat prescriptions for oral contraceptives. And we want to do more. Healthcare of providing medicines that have a therapeutic benefit, that have demonstrated safety and quality, not these devices containing nicotine that have questionable therapeutic benefit, questionable long-term safety. We don't even know, Peter, from our professional indemnity perspective, whether we'll be covered to provide these products without a doctor's prescription. We don't know what it means for our business insurance premiums potentially becoming a target for organised crime. There's so many different considerations. And what we need to do here is the government has an opportunity to pause here and not go ahead with this. And it's being debated in the Senate and across the aisle from the government. There could be some likelihood that there could be support for the bill in its original form from the House, that, to continue in its original form on a doctor's prescription.
Down the path of the GP.
We need to sit down and
what happens, Anthony?
Yeah.
Just to interrupt there, sorry. What happens if a pharmacist was to say, no way, I'm not going to sell vapes. It goes against everything we believe in as healthcare professionals. Can the government force you to do that? No,
the Minister Butler indicated today that would not be forced on individual pharmacies. It's a matter for individual pharmacies to make that decision or choice whether they do so. And I've been contacted by dozens of pharmacy owners and pharmacists in the last 24 hours, horrified at this proposal, which the Pharmacy Guild and our profession strongly opposes and weren't consulted on. So I can tell you there will be many pharmacies that will choose not to do so. As a Schedule 3 or pharmacist-only medicine, we have a legal and professional obligation to determine a therapeutic need for a patient before supplying that medicine or good. And it's very difficult to demonstrate a therapeutic need if something is not a therapeutic device or good, and there's no guidance as to when you should or really shouldn't provide that.
All right, keep fighting, Anthony. We'll stay across it here on Credlin and see what happens in the next couple of days. Thanks for joining us tonight.